Hello, welcome to my channel. The title of my video is on mood disorder. I will be doing questions and answers taken directly from RN Nclex examinations. Please hit the thumbs up, please subscribe, please share this video. My first question: what are the behavioral signs and symptoms of bipolar? The correct answer is pacing halts throughout the day, exhibits poor impulse control are your behavioral signs and symptoms of bipolar. My next question: what would be your nurse's first assessments for patients admitted with a diagnosis of bipolar? The correct answer: assess pacing halts, assess experiencing irritability and flight of ideas. My next question: what would be your priority nursing diagnosis for irritability, grandiosity, sleeping 2 hours at night? And the correct answer is disturbed sleep patterns related to agitation would be your correct answer. My next question is: what would be the priority nursing diagnosis for client admitted diagnosed with bipolar, experiencing maniac episodes? The correct answer is risk for violence related to poor impulse control would be your correct answer. Let's talk about outcomes for your bipolar. Client with bipolar diagnosed has disturbed thought process related to biochemical alterations. What will be your outcome for this patient? The correct answer: client will distinguish reality from delusions by day 5. My next question: clients with bipolar, what would be your intervention for this patient when this client is admitted? And the correct answer: the client will exhibit no evidence of physical injury. The client eats 70% of all finger food offered. Please note, client always pacing, do not have time to sit and eat. Clients are offered finger food. The next intervention is the client accepts responsibility for own behavior. Next, the client is able to access available outpatient resources after discharge. So these will all be your expected outcomes for patients with bipolar. Client will exhibit no evidence of injury. Client will eat 70% of the meals, will offer finger foods. Client is pacing all over. Client will take responsibility for behavior. Client will be offered outpatient resources at time of discharge. These are expected outcomes for our bipolar patients. Client with bipolar. Nurse's diagnosis is social interactions related to egocentrism. Which long-term outcome would be appropriate for this client? And the correct answer is client will have an appropriate one-on-one interaction with a peer today. The question is, client diagnosed with bipolar, nursing diagnosis of social interactions related to egocentrism. Which long-term outcome is appropriate? And the correct answer, client will have appropriate one-on-one interaction with a peer today. Next question. A newly admitted patient is admitted experiencing irritability, poor speech, increased anxiety. What would be your priority intervention for this new admission? And the answer is assess vital signs, complete physical assessment. A newly admitted patient is experiencing irritability, poor speech, increased anxiety. What would be your priority intervention? And the answer is vital signs and complete physical assessment. We're trying to differentiate physiological versus psychological. After we have determined is presenting symptoms and not physiological, then we'll assess this patient for psychological disease. Our next question is, client is experiencing maniac episode, nursing diagnosis, imbalanced nutrition, less than body requirement. Which meal would be appropriate for this client with a maniac episode? And the correct answer is finger food. Client cannot sit still to eat. Chicken fingers, French fries would be good for this patient. Finger foods. Client would not be able to sit still during increased psychomotor activity such as pacing. Hyperactivity during maniac episode affects client's ability to meet nutritional needs. So we'll offer clients in the maniac episode finger foods. Our next question, client is bipolar, provocatively dressed, observed laughing loudly with peers. What would be your priority action? And the correct answer is privately discuss with the client inappropriate, provocative dress, and the word is privately is your correct answer. My next question is, bipolar patient in maniac phase is yelling to another pair. Which nursing intervention takes priority? And the answer is calmly. Calmly direct and remove client from milieu. This client is in the maniac phase. Next question. Client with bipolar, nursing diagnosis, risk for injury related to extreme hyperactivity. What would be your nursing intervention? And the answer is for client diagnosed risk for injury. Risk for injury. Extremely hyperactivity. Your correct answer is administer antipsychotic medication. This client is running all over the place, maniac, risk for falling, injury. This client needs to be medicated. Next question, client is ready for discharge. What resource would be included for your clients with mood disorders, bipolar? And the correct answer is resources are financial and legal assistance, crisis hotlines, information, individual psychotherapy, support groups, family education group. These would be your resources at time of discharge. The next question is, what is the definition of grandiosity? And your correct answer is an exaggerated self-importance, power, status of self-importance. It is used by clients with bipolar, affective disorder, to help to reduce feelings of insecurity by increasing feelings of power is your correct answer for the definition of grandiosity. Our next question is, we're doing teachings for clients who are prescribed with lithium carbonate. Some of these patients are going home on lithium carbonate. You have to give them teaching. What would you teach? And the correct answer is, make sure your salt intake is consistent. Risk toxicity related to salt intake can cause serious injury or death. Lithium is a similar chemical structure to sodium, behaving in the body in much the same manner and competing with sodium at various sites of the body. So clients on lithium going home should be taught that will teach there is risk for toxicity, and they should make sure their salt intake is consistent. Please hit the thumbs up. Please share this video. Please subscribe. Thank you. Have a good day.